Thanks so much for giving me this opportunity to share with you the lessons learned in our project we implemented in Pamba, Nkata Bay, titled Family Interventions for Adolescents HIV Prevention. I am Anthony Ngwira, the Country Programs Coordinator for the New Apostolic Church Relief Organization. NAPRO is an NGO under the New Apostolic Church in Zambia, Malawi, and Zimbabwe. And this NGO was formed in the year 2002. Now, coming to the project itself, the overview. Committee members still have mixed feelings on the prevention measures of HIV. Majority of committee members are still inclined to cultural and biblical beliefs that deter adolescents from accessing HIV services and that influence stigma and discrimination. Adolescents are so vulnerable to HIV infection as they are in the learning phase. Parents do not usually talk to their children openly about love, sex, sexuality, and contraception because they fear to encourage them to be sexually active or due to lack of adequate information. Adolescents therefore rely on their peers on information for sexual matters, and very often this information is inaccurate, confusing, misleading, and sometimes completely false. Hence, this project, with the goal of contributing to improved sexual and reproductive health and rights information among the young people aged 20 to 24, the project mainly used 3 approaches to increase awareness of an access to sexual and reproductive health and rights services by adolescents and young people in the family and target areas. The first approach was family intervention program. To reach adolescents and youth in and out of school, the project worked through family settings to provide and promote integrated sexual and reproductive health education and counseling services. The family intervention focused on supporting families to have positive perceptions and effective communication about sex and reproductive education to enhance HIV prevention. And building capacity amongst parents was emphasized to provide friendly and informative messages to the adolescents and the young people. The second approach that was used was school-based health program. And through this, NAPRO worked with the selected primary and community secondary schools with guidance and materials of the Ministries of Education and Health to protect and promote the rights of adolescents and young people to sexual and reproductive health information and services. The project promoted and provided health environment and an efficient means to improve the well-being of school-going boys and girls. And specific activities that were used included training of guidance and counseling teachers, guidance counseling sessions, identification of girls that need support, for example, sanitary materials and school fees, and then referrals to NAPRO for other support. The third approach that was used was church-based integrated health education and services. NAPRO used the church settings to provide integrated sexual and reproductive health education and counseling services. The project worked with church-based women and youth groups to create awareness and increase demand for the adolescents and youths for integrated reproductive health education and services. This promoted voluntary abstinence, counseling, and other services to sexually active youths, gender-based violence, and preventions of sexually transmitted infections. Now, coming to the results of the intervention. We experienced some positive results, and these were improved family interactions for HIV prevention. The other result was that 82% of the women and girls that we target were engaged in income-generating activities and farming activities in order to gain more money for their livelihoods. And this was done mainly by us creating savings and loan groups that were developed solely as part of the intervention. This reduced the women or girls' dependence, especially girls that were out of school, on their male counterparts. The other result was the social groups, church groups, and savings groups. These increased the number of meetings and mainstreamed issues of HIV and gender-based violence in their meetings. There was also an increase of church members engaged in HIV activities. 7% of the targeted parents were motivated to challenge the taboos and to promote adolescent well-being. According to Ministry of Health data, the number of new HIV infections amongst the children and adolescents in the targeted community dropped by around 29%. As well as the uptake of HIV prevention advice by the adolescents and young women was demonstrated in national health reports, which recorded a reduction in HIV prevalence to about 7.3% in 2016 in the Malawi North. The increase in knowledge of HIV prevention had positively contributed to the demand of HIV testing and treatment. Whilst there is evidence that the project strategies have been successful in engaging families and young people about HIV and reproductive health, more work remains to be done with some committee members and religious leaders to tackle belief in faith healing rather than ART treatment. However, there were some factors that promoted further implementation or possible scaling up of the intervention. And these factors included availability of evidence-based information on HIV and reproductive health from government and other institutions that do play a role in HIV prevention. Secondly, ability of NACRO to integrate HIV prevention with other projects in education and livelihoods. In addition, families acquired knowledge and willing to discuss issues pertaining to sexuality with their children and able to work with faith-based organization on HIV prevention. We are well-positioned as an organization to reach out as there is clear understanding and good relationship with the local communities. However, there are still factors that hinder or that may hinder further implementation or scaling up of the intervention. These mainly were factors such as limited financial resources that limited the possibility of scaling up and failure to attract adequate expertise within the organization due to small budget. And at this point in time, I thank you for your attention. God bless you. Thanks so much.